Welcome to the Neuro Wellness Channel, your trusted source for discovering the hidden health secrets of aging. If you care about staying sharp, strong, and independent as you grow older, make sure to like this video and subscribe for more valuable content every week. Most people believe that getting weaker, slower, or unsteady after age 60 is just a normal part of aging, but that is not entirely true. In this video, we will uncover 3 powerful vitamins that are essential for maintaining leg strength, balance, and mobility. These nutrients could make the difference between a life of freedom and one of dependence. Many older adults lack them without even knowing it. Do not wait until it is too late. Watch now and learn how a few small changes can help you stay active, confident, and strong well into your later years. Part 1. Vitamin D. Maintaining muscle strength. As we age, maintaining muscle strength becomes increasingly important to preserve mobility, independence, and overall quality of life. Among the various nutrients that play a crucial role in muscle health, vitamin D stands out as one of the most essential. While most people associate vitamin D with bone health, its influence extends far beyond that. Vitamin D also plays a fundamental role in muscle function, especially in the lower limbs. Without adequate levels of this vital nutrient, everyday movements such as walking, climbing stairs, or standing up from a chair can become noticeably more difficult. Vitamin D contributes to muscle strength by supporting the contraction and repair of muscle fibers. It acts directly on muscle tissue through specialized receptors, called vitamin D receptors, that are embedded in muscle cells. When vitamin D binds to these receptors, it helps regulate the synthesis of proteins that muscles need to function efficiently. Additionally, it enhances the muscle's ability to respond to neural signals, which improves coordination and stability. This is particularly crucial for the large muscle groups in the legs, which are responsible for weight-bearing activities and balance. When the body lacks vitamin D, these processes begin to deteriorate. Individuals may begin to experience muscle weakness, which is often most noticeable in the thighs and hips. This weakness can manifest as difficulty in climbing stairs, feeling unsteady when walking, or requiring support when getting up from a seated position. Some people develop what is commonly described as a wobbly gait, where their walk becomes unstable and uncoordinated. Although these symptoms may be dismissed as a natural part of aging, they often signal a deficiency in vitamin D. One of the reasons vitamin D deficiency becomes more common with age is that the body's ability to produce it declines over time. The primary natural source of vitamin D is sunlight. When the skin is exposed to ultraviolet B, UVB, rays from the sun, it produces a form of vitamin D that is then converted into its active form in the liver and kidneys. However, as we age, the skin becomes less efficient at producing vitamin D. In addition, many older adults spend more time indoors or are advised to avoid direct sunlight due to skin cancer concerns. Even when they do go outside, wearing long sleeves, hats, or sunscreen significantly limits the amount of UVB exposure the skin receives, further reducing vitamin D synthesis. Dietary sources of vitamin D can help fill the gap, but they are often insufficient on their own. Foods rich in vitamin D include fatty fish such as salmon, mackerel, and sardines, as well as egg yolks and fortified dairy products. Unfortunately, many people do not consume these foods in sufficient quantities on a daily basis to meet the recommended levels. As a result, a significant portion of the older adult population becomes at risk for vitamin D deficiency without realizing it. The good news is that vitamin D deficiency is both measurable and treatable. A simple blood test can determine your current vitamin D levels. Most health experts agree that a level of at least 30 nanograms per milliliter, nanogram per milliliter, is necessary for optimal muscle and bone health. If your levels are below this threshold, your doctor may recommend vitamin D supplementation. For most older adults, a daily supplement of 800 to 1.000 international units, IU, of vitamin D is considered both safe and effective. In some cases, higher doses may be necessary, particularly for those with severely low levels or conditions that impair absorption. In addition to taking supplements, modest and safe sun exposure can also help raise vitamin D levels. Aim to spend about 15 to 30 minutes outdoors a few times per week, preferably in the early morning or late afternoon when the sun's rays are less intense. Exposing your arms, hands, and face without sunscreen during these times can provide a meaningful boost to vitamin D production. However, it is important to avoid prolonged exposure during peak hours to minimize the risk of skin damage. The benefits of restoring adequate vitamin D levels go beyond just muscle strength. Improved muscle function contributes to better balance, reduced risk of falls, and increased confidence in movement. For older adults, even small improvements in strength and stability can lead to significant enhancements in independence and quality of life. A person who once struggled to climb stairs or feared walking without support may regain the ability to perform these tasks more comfortably and safely. Ultimately, vitamin D should be viewed not only as a bone health nutrient but as a foundational element of physical vitality. As part of a comprehensive approach to aging well, ensuring sufficient vitamin D intake can make a meaningful difference in how strong, stable, and capable you feel each day. If you have noticed changes in your ability to move or maintain balance, it is worth discussing vitamin D with your healthcare provider. With simple steps, testing, supplementing, and modest sun exposure, you can give your muscles the support they need to keep you active and independent. Part 2. Vitamin B12 supporting smooth nerve function. Vitamin B12 is a vital nutrient that plays an essential role in maintaining the health of the nervous system. While many people associate this vitamin with energy levels or red blood cell production, its impact on nerve function, particularly in older adults, is profound. As we age, the risk of vitamin B12 deficiency increases significantly, and this often contributes to a wide range of neurological symptoms that can impair movement, balance, and quality of life. Understanding the role of vitamin B12 and recognizing its deficiency is a crucial step in preserving coordination and preventing avoidable decline in older age. One of the most important functions of vitamin B12 is to support the formation and maintenance of the myelin sheath. This protective covering surrounds nerve fibers and acts much like the insulation around electrical wires. It allows nerve signals to be transmitted rapidly and efficiently from the brain to the rest of the body. When vitamin B12 is in short supply, the myelin sheath begins to deteriorate, which disrupts the communication between nerves and muscles. As a result, individuals may experience various symptoms such as numbness, tingling sensations, muscle weakness, or even a loss of coordination, especially in the lower limbs. These symptoms often start subtly. An older adult might feel a mild tingling in the feet or a sense of pins and needles that comes and goes. Over time, this can progress to more concerning signs, such as difficulty walking in a straight line, an unsteady gait, or feeling like the legs are not listening to the brain's instructions. These changes can easily be mistaken for normal aging or attributed to general fatigue. However, they may indicate an underlying vitamin B12 deficiency that is silently affecting the nervous system. The causes of vitamin B12 deficiency in older adults are often related to absorption issues rather than inadequate intake. Unlike many other vitamins, vitamin B12 is not easily absorbed through the digestive system without the aid of intrinsic factor, a protein produced by cells in the stomach lining. As people grow older, the stomach tends to produce less acid and less intrinsic factor. This natural decline in gastric function makes it harder for the body to extract vitamin B12 from food. Furthermore, many older adults take medications that further reduce stomach acid, such as proton pump inhibitors or antacids, which can worsen the issue. In addition to these challenges, certain medications commonly prescribed for chronic conditions in older adults can interfere with B12 absorption. For example, metformin, a drug frequently used to treat type 2 diabetes, has been shown to reduce the body's ability to absorb vitamin B12 when taken over long periods. This makes it even more important for individuals taking such medications to monitor their vitamin B12 levels regularly. Deficiency in vitamin B12 can have serious consequences if left unaddressed. In severe cases, individuals may develop peripheral neuropathy, a condition in which nerves outside the brain and spinal cord become damaged. This condition can lead to permanent nerve damage and chronic pain, which may severely affect mobility and overall well-being. One particularly troubling manifestation of vitamin B12 deficiency is a wide-based gait, where a person unconsciously spreads their feet farther apart while walking to compensate for the lack of balance. This walking pattern significantly increases the risk of falls and injuries. Fortunately, vitamin B12 deficiency is relatively easy to diagnose and treat. A simple blood test can measure serum B12 levels and determine if intervention is necessary. For those with low or borderline levels, supplementation is the most effective treatment. Most people respond well to a daily oral supplement of 500 to 1,000 micrograms of vitamin B12. These supplements are generally safe, as vitamin B12 is water-soluble, meaning any excess is excreted in the urine. In cases where absorption is severely impaired, vitamin B12 may need to be administered via intramuscular injection, which bypasses the digestive system entirely and delivers the vitamin directly into the bloodstream. The improvements after supplementation can be significant. Many individuals report feeling steadier on their feet, regaining sensation in their extremities, and experiencing a general improvement in balance and mobility. These changes can restore confidence, reduce the fear of falling, and encourage more physical activity, which in turn supports cardiovascular health and mental well-being. For older adults, even small improvements in coordination can make a profound difference in their ability to live independently and engage in daily life without fear or discomfort. Dietary intake remains an important factor as well. Vitamin B12 is naturally found in animal-based foods such as meat, poultry, fish, eggs, and dairy products. However, even with a diet that includes these foods, absorption issues may still lead to deficiency. That is why regular monitoring and early intervention are key, especially for those over the age of 60 or those taking medications known to interfere with B12 absorption. In conclusion, vitamin B12 is far more than just a nutrient associated with energy. It is a critical component of nerve health and plays an irreplaceable role in ensuring smooth and accurate communication between the brain and muscles. A deficiency can lead to symptoms that significantly affect balance, coordination, and overall quality of life. Thankfully, with proper testing, timely supplementation, and nutritional support, these symptoms can often be reversed or greatly improved. Older adults experiencing unexplained changes in their walking, balance, or leg sensation should not dismiss these signs as simple aging. Instead, they should consider the possibility that their nervous system may be asking for help, and vitamin B12 may be exactly what is needed. Part 3. Vitamin B1, thiamine, providing energy for muscles. Vitamin B1, also known as thiamine, is one of the most underrated yet essential nutrients required for maintaining optimal muscle function and energy metabolism. While it may not receive as much attention as vitamins D or B12, thiamine plays a unique and critical role in helping the body convert food into usable energy. For older adults, maintaining adequate levels of vitamin B1 is particularly important, as its deficiency can lead to serious physical symptoms such as leg fatigue, poor coordination, and difficulties in walking. Recognizing the importance of thiamine and how to prevent or correct its deficiency is a crucial step toward preserving mobility, independence, and overall vitality in later life. Thiamine is a water-soluble vitamin that acts as a coenzyme in several enzymatic reactions involved in carbohydrate metabolism. Specifically, it is necessary for the proper function of an enzyme complex known as pyruvate dehydrogenase, which helps convert glucose, your body's primary fuel source, into energy. Without sufficient thiamine, this metabolic process becomes impaired, and the cells, especially muscle cells, cannot produce enough energy to function properly. Since muscles require a continuous supply of energy to support movement and maintain tone, a deficiency in thiamine can lead to muscular weakness and rapid fatigue. Older adults are especially vulnerable to thiamine deficiency for a variety of reasons. First, as people age, their appetite may decline, leading to lower overall nutrient intake. Diets may become repetitive or lack variety, and essential vitamins like thiamine may be consumed in inadequate amounts. Many elderly individuals gravitate toward diets that are high in refined carbohydrates such as white rice, white bread, crackers, and noodles. Unfortunately, these foods are often stripped of their natural vitamin B1 content during processing. While they may provide calories, they offer very little nutritional value, contributing to a form of energy deficiency at the cellular level. Another important factor contributing to thiamine deficiency in older adults is the use of certain medications. Diuretics, which are commonly prescribed to manage high blood pressure, heart failure, and other cardiovascular conditions, can cause the body to excrete thiamine in the urine at an accelerated rate. Over time, this increased loss can deplete the body's thiamine stores. Additionally, individuals who consume alcohol regularly, even in moderate amounts, may face a higher risk of deficiency because alcohol interferes with thiamine absorption and utilization. When thiamine levels fall below the body's needs, the early symptoms can be subtle and often go unnoticed. Individuals may begin to feel unusually tired. Even after minimal exertion, they may notice that walking short distances requires more effort than usual or that their legs feel heavy or sluggish. Muscle cramps, especially in the calves, may occur more frequently. Over time, these symptoms can progress into more serious issues, such as difficulty maintaining balance, poor coordination, and even a shuffling or dragging walk. These are not merely inconveniences, they can significantly limit mobility and increase the risk of falls, injury, and loss of independence. In severe cases, thiamine deficiency can lead to a condition known as dry beriberi. This neurological disorder specifically affects the peripheral nerves and muscles, resulting in symptoms such as numbness, tingling, burning sensations, and profound weakness in the legs and feet. Individuals with dry beriberi may also develop what is called foot drop, where they are unable to lift the front part of their foot, causing them to trip or stumble. Although full-blown beriberi is rare in developed countries today, milder forms of thiamine deficiency are surprisingly common and are frequently misdiagnosed as other age-related conditions. Fortunately, diagnosing thiamine deficiency is relatively straightforward. A healthcare provider can assess dietary habits, review medication use, and, if necessary, order blood tests to measure thiamine levels. If a deficiency is detected, treatment is both simple and effective. Thiamine supplements are widely available, and the recommended daily allowance for adults is around 1.1 to 1.2 milligrams. In cases of deficiency, a higher therapeutic dose may be prescribed temporarily. Thiamine is water-soluble, meaning the body excretes any excess, and there is minimal risk of toxicity. Dietary improvements are equally important in addressing and preventing thiamine deficiency. Foods that are naturally rich in thiamine include whole grains, legumes such as beans and lentils, seeds like sunflower seeds, nuts, pork, and organ meats such as liver. Incorporating these foods into daily meals can help maintain healthy thiamine levels and support sustained muscle energy. For individuals who follow restricted diets or have trouble eating certain foods, a high-quality multivitamin that includes thiamine can be an effective alternative. Many people who begin taking thiamine supplements or making dietary changes report noticeable improvements within a matter of weeks. A woman in her 70s, for example, who had experienced chronic leg fatigue and frequent stumbles, found that after just 3 weeks of thiamine supplementation and minor dietary adjustments, she was able to walk to her mailbox without assistance for the first time in months. Such outcomes may seem modest but often represent powerful gains in confidence, independence, and quality of life. In conclusion, vitamin B1, or thiamine, is an essential nutrient that serves as the metabolic spark behind every step we take. Its role in converting food into usable energy is critical for the proper functioning of muscles. Especially in the legs, deficiency can result in significant physical limitations. But with awareness, early detection, and appropriate intervention, these effects can be reversed or prevented. Older adults should remain vigilant about their dietary habits, medication use, and physical symptoms. If walking becomes more difficult, if fatigue sets in quickly, or if coordination begins to slip, it may not simply be aging, it could be a sign that the body is lacking the energy-driving power of thiamine. Many people live with the daily struggle of legs that feel unusually heavy, or a gait that becomes unsteady without warning. These are not just signs of aging, they may be early warnings of a thiamine deficiency quietly affecting muscle energy and nerve coordination. Recognizing these signs early is essential. The good news is that recovery often begins with small, simple steps. A blood test, a change in diet, or a thiamine supplement. Within weeks, Many notice reduced fatigue, improved steadiness, and a renewed ability to walk with confidence. It is a quiet but powerful reminder that sometimes restoring strength is not about doing more, but about giving the body what it has been missing all along.